We're almost done, but there's one more difference between opioids and other medications you should know about, just so you won't be surprised. Once you and your healthcare provider have decided on opioid therapy, you may be asked to sign what's called an opioid agreement. That probably sounds scary and intimidating, but all it really is a form that says you understand that opioids are powerful drugs with potential risks and side effects, and that you consent to being treated with them.
An opioid contract might be presented to you by your healthcare provider. And the contract is in the interest of all, of the prescribing healthcare provider, and of course, in your best interest. You should read the contract, understand it, and then you will be required to sign the contract by your healthcare provider.
Many people have heard of the term opioid contract or opioid agreement. And it's interesting because I don't know of any other medication that patients are asked to sign a contract before they receive. Many patients find this offensive at first, and I explain it to my patients as a device that helps to guarantee their access to controlled substances and helps to guarantee my license to prescribe them. The fact is that many physicians are afraid to prescribe opioids either because they're concerned about harm to the patients or because they're frankly concerned about harm to themselves. The opioid contract often gives the physician the confidence he needs to be able to provide a treatment that the patient needs that he might otherwise be fearful of providing, so that it does have this benefit for both parties.
One of the reasons physicians ask individuals to sign these agreements is that we're recommended to do so by our organizations that we belong to. But from a medical perspective, we need to have an understanding with our patients about what they're doing by taking an opioid, because it's a serious drug. They can be highly effective and highly injurious as well.
It's become somewhat controversial about the use of opioid contracts or agreements is probably the right term to use. But I think of an agreement, an opioid agreement is just like consent I get with any patient, whether I do a procedure or I explain to them what a treatment's going to be. We get consent, verbal consent all the time across medical fields and specialties. And so I think with regards to opioids, an opioid agreement is just a written consent.
When you sign an opioid agreement, you're not signing your life away. What you are doing is acknowledging that you are aware of both the benefits and uncertainties of opioid therapy, and that you accept the obligation of using opioid drugs responsibly, including the absolute need to be honest and upfront with your healthcare provider so that he or she can give you the safest, most effective care possible. Different contracts use different words, but it all comes down to the same thing: your commitment to help your healthcare provider help you.
It's really a relationship between you and the healthcare provider. And what an opioid contract is supposed to do is explain the risks of opioids so you can read it, because we often know that people, even though we discuss it with them verbally, they may not remember the side effects or may not truly understand them. So it helps bring an educational process. Also, it describes the guidelines for opioid treatment.
It's very educational. It talks about constipation, side effects, withdrawal. It also gives some of the ground rules for the practice. And I explain to them that that's going to be easy for them to understand what we expect of them. And it's going to make it easier for them to understand how they're going to interact with the nurses about refills and everything. So I like to explain to them that it's more of an open way of describing what's going to be the next step.
I think the opioid contract accomplishes several things. And the first is that it gives the patient a written description of the downside of opioid therapy. It tells them about risks, and it can serve as a reminder that they can look at if they forget, which people do. The second thing that the contract does is that it really establishes in black and white what the expectations of both parties are. This is what I expect a patient to do if they want to receive chronic opioids. I expect them to tell me if they're getting medicines from other doctors. I expect them not to get opioids from anybody but me. I expect them not to combine their opioids with marijuana and cocaine. And if they're not willing to adhere to this, then I'm not willing to provide them with opioids. A, because it's not safe, and B, because it would expose me to sanctions.
The opioid contract covers a number of behaviors. And one of these behaviors is that you will agree to using only one pharmacy to have your prescriptions filled at. Another behavior is that you will not hoard your medicine and that you will not divert your opioid medicine. Another behavior would be that you will be very conscious of where you store your medicine so that it will be unavailable to other family members, and that, too, if you need to, you would dispose of your medicine properly.
The physician will often put in an agreement that if the individual runs out of medication ahead of time, they will not be filled early. The prescription will not be refilled early. For instance, I'll have a patient come into my office and say, my medicines were stolen. The dog ate them. I accidentally dropped them down the toilet. Well, you know, maybe the first time that's okay for some doctors, but basically that is a concern on the physician's part that the patient may be misusing or even abusing medications. And so by having it in a written contract, the physician and the patient both know where they stand.
You may also be asked to give an occasional urine sample. Now, all these requirements are not that your healthcare provider does not trust you. They are just a very necessary requirement to protect all the individuals that are entering into the agreement.
The other important item that should be in a contract is that when we treat pain, we have to treat it from multiple pathways. Pain medications, coping strategies, possibly procedures, physical therapy. And what an opioid contract should really say is that we want to use these medications as part of that treatment, but it's not the only path that we're going to take. And so you have to be willing to have an active role in your own medical well-being.
Most people are suspicious of forms, but the opioid contract isn't a trick or a trap or a gotcha. Certainly, it protects your healthcare provider, but it's also designed to protect you by ensuring that you have access to the medications you need and confirming that you understand both what you can expect from your treatment and what your treatment will require from you.
Some people are concerned that these opioid contracts or agreements are too restrictive. In fact, some people even complain that perhaps the doctor doesn't want to treat them and that's why they're so restrictive. I really don't believe that's true. Quite frankly, if your doctor doesn't want to treat you, I don't think you should go to that doctor anyway.
I definitely think that, you know, physicians can't use an opioid agreement as a means of firing someone from their practice or their clinic. You know, patients, you know, should never feel abandoned. There should be dialogue and there should be, you know, consequences for their actions. And so we, you know, document if there's a problem with a medication, did the patient violate our agreement? And then this is what's going to happen if they don't do it. And so, you know, the patient should never feel like they're being forced to sign something that's going to be used to discharge them from their practice.
Another reason physicians ask patients to sign these agreements is not only to protect the patient, but to protect the doctor. Doctors are extremely wary these days. On one hand, they want to help their patients, but on the other hand, they're under quite a bit of scrutiny from the federal government. And in fact, it gets even worse than that, because if you don't prescribe enough medicine, you could be sued. And if you prescribe too much, you could be sued. And so the agreement is a way to have a written understanding between two individuals. In a sense, it is a contract. This is where I stand, and this is where you stand, and this is what we agree to do together.